So good afternoon. This is essentially going to be a literature review of about functional MRI in spine from the eyes of an orthopedic spine surgeon. So that's all it's going to be. I'm glad that Dr. Thapar is here. So if any machine related queries, you can direct to Dr. Thapar only. So functional MRI brain started off in the early 90s, and over the years it's been clinically useful right now, especially for epilepsy surgeries and tumor resection surgery. So we can know prior hand that what the surgery which is going to happen, which part is glowing and which part has taken over the function. If you resect a part, which of the functions the patient is going to lose prior to the surgery. So that's the benefit of a functional brain MRI, and that's been routinely done nowadays for the epilepsy surgery and all the benign and malignant tumor resection surgeries to prognosticate things. Now researchers started having something similar if it can be done to the cord. The advantage being it's non-invasive, you can have higher resolutions as well, and as we are used to seeing these images, the images of the spinal cord, what if we can get this resolution and see the dorsal horn as well as the ventral horns in the spinal cord? And that's the reason this functional MRI has been done, high resolution images, to see the typical anatomical butterfly or the gray matter which we are used to see in anatomical books. Now the principle again is the same. Principle is that any neural tissue, when it activates, the blood supply to that neural tissue increases, and a functional MRI sequence actually picks up that increased blood flow, and that's how you get indirect assessment of a function of the spinal cord, or for the matter brain as well. And that is called a blood oxygen level dependent MRI. So that's the main principle, that any neural activation increases blood flow, and the oxyhemoglobin is measured by the functional MRI machine. So as I said, this is almost similar. If you can see this similar picture of the dorsal and the ventral horns, basically the gray matter, and once you put it through all the MRI acquisition techniques and post imaging statistical analysis, you get something like these images. All these are color coded to see how much blood uptake has been happening, so you know which part is functioning. Now that's where the similarity ends, because brain versus cord, the spinal cord is a tiny structure, 1 to 2 centimeters of structure as compared to the brain. There is a significant variability of the tissues, the bony anatomy, the muscular tissues, they are significantly magnetically variable, and importantly, there is a significant physiologic noise. Like when you put in the patient to MRI machine, you have the deglutition which is still happening, the esophagus still moves around, the cardiac pulsations, the respiratory pulsations, and the squishing of the tummy contents. Everything causes a noise, which also the machines have to delete the noise to give you a proper image. Theoretically, the applications currently being researched, it's still not into clinical practice, but research wise they have been doing for spinal cord injury patients. So far we used to think that once the spinal cord is transected completely, you don't get any signals distally to the transections. So the functional MRI has told that even at resting stage, you have certain amount of activity going on distal to the injury which has happened. That has important implications, like if you can have some drug trials for spinal cord injury patients, if you have a functional MRI pre-operatively as well as after the trial, you can gauge whether this thing is going to recover or not recover. People have been trying to see not only the spinal cord, but spinal cord along with the brain, to see what sort of activities and neural structures and what activations happen for a cervical myelopathy patient. What happens as when you have the cord signal along with the brain signal, and when it comes back to the cord, what happens? What can you prognosticate if you do a surgery for this patient? So all these aspects are being studied. Obviously, I told about tumors, so spinal cord tumors also, after resecting, which function is going to remain, you can tell pre-operatively to the patient. And the holy grail of low back pain, chronic low back pains, neck pains, fibromyalgia patients, if we can have a better understanding through this tool, a research tool, we can come to some conclusions regarding what treatment modality is generally going to benefit our patients. So far these are the applications which are still in the research based, they have not come into clinical practice. So, but it's still a research tool, and potentially it shows significant promise. It took almost 20-25 years for researchers to reach at this stage, And there's no doubt that is going to widen our information about different pathologies and different issues regarding the spine. Thanks.